My name is Sabrina Strickland. I'm an orthopedic surgeon here on the Sports Medicine and Shoulder Service. I predominantly do shoulder and knee surgery. The two most common injuries I see in athletes are ACL tears and shoulder dislocations. And sometimes it's real trauma that causes these injuries. Sometimes it's not a particularly impressive injury until it happens, meaning you may just twist your knee a little bit on the field, feel a pop, and can't keep playing, and then you know several hours later that it's a big deal. Occasionally, the goals are not to get back to sports. The goals are to walk and be able to use exercise machines, and then often you can get away with just doing physical therapy and not have to have an operation. But for the vast majority of patients I see, their goal is to get back to the sport that injured them in the first place or during which they were injured. So most of those patients elect to have surgery. When we reconstruct an ACL, we actually are making a new ligament, and the body has to heal that, and it has to remodel that, and you have to get stronger. And so part of it is waiting, and part of it's physical therapy and time to get the strength back. My typical patient, no matter what their age is that they want to do what they used to do, whether it was 5 years ago or 10 years ago. That's sometimes possible, it's sometimes not possible. But ideally, I'd like to prevent any significant decline. If you tear your rotator cuff, I want to take care of it soon enough so that there's no atrophy and you can get back to tennis or you can get back to golf. I think patients are all very different. I don't treat the two ACLs the same way because they have different goals. They may have different needs as far as what they need to get back to, and you really have to treat each patient differently, even if they have the same problem. The entire hospital is dedicated to the same thing as me, meaning we're not worrying about cardiac patients. We don't have sick patients recovering from pneumonia. We're all basically here with the same goal, is to get patients back to their former mobility or to get them over their orthopedic injury, which makes it unique. Physical therapy all has the same goals. We treat the same kinds of patients, and it means that we're very unified in the way we approach things.